Your body may be sending you warning signals right now, and you might be mistaking them for stress, hormones, or just getting older. Doctors say millions of women live with high blood sugar for years without knowing. Today, we reveal 8 early signs your body could be quietly trying to tell you something. Before we get into the signs themselves, let's quickly talk about what's actually happening inside your body when blood sugar starts to rise. Every time you eat, your body breaks food down into glucose, which is essentially fuel for your cells. Your pancreas releases a hormone called insulin, and insulin's job is to act like a key, unlocking your cells so glucose can get inside and be used for energy. When this system works well, your blood sugar stays in a healthy, stable range. But when your cells stop responding properly to insulin, a condition known as insulin resistance, glucose starts building up in your bloodstream instead of being used efficiently. Over time, this can progress from what's called prediabetes into type 2 diabetes. And here's something a lot of people don't realize. This process can take years, sometimes even a decade, before it's officially diagnosed. During that entire window, your body may already be showing signs. Now, here's why this matters so much specifically for women. Female bodies experience constant hormonal fluctuation through the menstrual cycle, pregnancy, and menopause, and these hormonal shifts can mask or mimic the very same symptoms that high blood sugar causes. So when a woman feels exhausted, foggy, or off, it's incredibly common for her and sometimes even her doctor to chalk it up to hormones, stress, or simply being busy. This is exactly why early signs of high blood sugar are so often missed in women. It's not that the signs aren't there, it's that they're easy to explain away. So let's change that today. Let's look at the first sign most women completely overlook. Sign number 1 is increased thirst that just won't quit. You drink a full glass of water and 10 minutes later your mouth feels dry again. This isn't your imagination, and it isn't simply drinking too little water in the way we usually think about it. When there's excess glucose in your bloodstream, your kidneys go into overdrive trying to filter it out, pulling extra water from your tissues in the process. The result is a kind of internal dehydration that triggers your brain's thirst signal again and again, no matter how much you drink. Most women brush this off as a side effect of hot weather, salty food, or just not drinking enough water that day. But if you notice you're constantly reaching for your water bottle and your mouth still feels dry, that's worth paying attention to, not panicking over, but paying attention to. Sign number 2, and closely connected to the first, is frequent urination, especially at night. If you find yourself getting up 2 or 3 times a night to use the bathroom, when that didn't used to be the case, your body may be trying to flush out excess sugar through your urine. This is your kidneys working overtime again. Many women assume this is simply an aging issue, a bladder issue, or something related to childbirth or pelvic floor changes, and sometimes it genuinely is. But when frequent urination shows up alongside increased thirst, that combination is one of the classic early indicators that blood sugar deserves a closer look. Sign number 3 is a kind of fatigue that sleep doesn't seem to fix. This is one of the most underestimated signs out there because almost every woman today feels tired. Between work, family, hormonal cycles, and simply the pace of modern life, exhaustion has almost become the default. But there's a specific kind of tiredness worth noticing here. When your cells aren't getting the glucose they need because insulin isn't doing its job properly, your body is essentially running low on usable fuel, even if you've technically eaten enough food. This can create a heavy, persistent fatigue that doesn't improve much with rest, and that shows up even on days when you've slept a full 8 hours. If you've ever thought, I shouldn't be this tired, that instinct is worth listening to. Now here's a question worth sitting with for a moment. If these signs are so common, so easy to explain away, how many women do you think are walking around with elevated blood sugar right now without realizing it? The honest answer is, we don't know exactly, but health researchers consistently point out that a significant portion of people with prediabetes are completely unaware of it. That's part of why this video exists, not to alarm you, but to help you recognize a pattern before it becomes something bigger. Sign number 4 is blurred or fluctuating vision. This one surprises a lot of people because we don't usually connect our eyes to our blood sugar, but here's the physiology behind it. When glucose levels rise, fluid can shift in and out of the lens of your eye, temporarily changing its shape and how it focuses light. Some women describe this as their vision being slightly blurry, or needing to blink more to focus on a screen or a road sign, and then it seeming to resolve on its own. Because it can come and go, it's incredibly easy to dismiss as eye strain from too much screen time, which, to be fair, is also extremely common. But if blurry vision is showing up as a pattern, especially alongside any of the other signs we've already covered, it's worth mentioning to your doctor. Sign number 5, the one that surprises even some doctors, is slow healing cuts and recurring infections, particularly yeast infections and urinary tract infections. Here's why this happens. Elevated blood sugar can impair circulation and weaken the function of your immune cells, making it harder for your body to fight off bacteria and yeast effectively and slower to repair damaged skin. For women specifically, this often shows up as more frequent yeast infections or UTIs than usual, or small cuts and scrapes that seem to take longer to close up than they used to. The reason this sign catches people off guard is that recurrent infections are often treated as their own isolated issue, treated with medication, and then forgotten about, rather than being recognized as a potential signal connected to blood sugar. If you found yourself dealing with infection after infection over the past year, this is a pattern worth raising with your healthcare provider. Sign number 6 is tingling, numbness, or a strange pins and needles sensation in your hands or feet. This can be one of the earlier signs of nerve sensitivity related to elevated blood sugar, sometimes referred to as early neuropathy. It doesn't always feel dramatic. Sometimes it's just an occasional tingling in your toes or a sensation that your foot has fallen asleep more often than it reasonably should. Because this can also happen from sitting in an awkward position, wearing tight shoes, or even certain vitamin deficiencies, it's another sign that's incredibly easy to brush off. But persistent, unexplained tingling, especially in both hands or both feet, is something doctors take seriously as a potential early marker worth investigating. Sign number 7 is unexplained weight change in either direction. This might surprise you because many people associate high blood sugar exclusively with weight gain. And while insulin resistance can absolutely contribute to weight gain, particularly around the abdomen, unexplained weight loss can also occur. When your body can't use glucose properly for energy, it may start breaking down muscle and fat for fuel instead, even if your appetite and eating habits haven't changed. So if you've noticed your weight shifting in a way that doesn't match your diet or activity level in either direction, that's a signal your body may be trying to communicate something, not a reason to celebrate or panic, but a reason to get checked. And sign number 8 is changes in your skin, specifically the appearance of dark, velvety patches, often around the neck, armpits, or other skin folds, a condition known medically as acanthosis nigricans, along with skin tags or persistent itchiness. These skin changes are linked to insulin resistance and are one of the more visible physical signs your body can show. Many women notice these changes and assume they're related to friction, sweat, or simply skin type, and sometimes that's true. But when these darker patches appear gradually and don't respond to typical skin care, it's worth mentioning to a doctor because skin can sometimes reflect what's happening internally before blood work even confirms it. So now you know the 8 signs. But here's the bigger question. Why do so many women go years without connecting these dots? Part of the answer lies in how closely these symptoms overlap with perimenopause and menopause. Fatigue, changes in thirst, skin changes, weight fluctuation, all of these can also be hormonal symptoms of this life stage, which means women going through this transition may have an even harder time distinguishing between this is menopause and this might be something more. The same overlap exists for women with PCOS, polycystic ovary syndrome, which is itself closely linked to insulin resistance, meaning some women may be dealing with two overlapping conditions at once without realizing the connection between them. On top of this, research has repeatedly highlighted that women's physical symptoms are sometimes minimized or attributed to stress and anxiety in clinical settings more often than men's are, which can unfortunately delay diagnosis even further. None of this is meant to create fear, it's meant to explain why awareness and proactive screening matter so much, because relying on symptoms alone isn't always enough. So if symptoms can be this misleading, how do you actually find out for sure? The answer is simple, and it's the single most important takeaway from this entire video. Get tested. There are a few standard tests doctors use. A fasting blood glucose test measures your blood sugar after not eating for several hours, usually overnight. An A1C test gives a picture of your average blood sugar levels over roughly the past 2 to 3 months, which makes it especially useful because it isn't affected by what you ate that morning. And an oral glucose tolerance test measures how your body processes sugar over a couple of hours after drinking a glucose solution. None of these tests are painful or complicated, and they can be done as part of a routine checkup. Now, who should consider getting screened? Generally speaking, women with a family history of diabetes, a personal history of gestational diabetes during pregnancy, a diagnosis of PCOS, or who carry extra weight around the abdomen are considered at higher risk and may benefit from more regular screening. But honestly, given how common undiagnosed prediabetes is, this is a conversation worth having with your doctor regardless of whether you fit neatly into a high-risk category, especially if you recognize two or more of the signs we just covered in yourself. Let's talk prevention and practical steps because this is where you actually have power. Diet plays a major role, but this doesn't mean extreme restriction or cutting out entire food groups overnight. Simple, sustainable changes make a real difference. Things like incorporating more fiber-rich vegetables and whole grains, prioritizing protein at meals to help stabilize blood sugar, and gradually reducing refined sugars and highly processed foods rather than eliminating them entirely overnight. Movement matters just as much as diet. Physical activity helps your muscles use glucose more efficiently and improves insulin sensitivity, and you don't need an intense gym routine to see benefits. Even a brisk 20 to 30-minute walk most days of the week can make a measurable difference over time. Sleep and stress management are often overlooked, but they're deeply connected to blood sugar regulation because poor sleep and chronic stress both raise levels of cortisol, a hormone that can interfere with insulin's effectiveness. And finally, regular checkups remain one of the most powerful tools you have because they catch what symptoms alone sometimes miss. Before we wrap up, let's clear up a few common myths. Myth 1: only sugar causes diabetes. In reality, blood sugar regulation is influenced by a complex mix of genetics, overall diet, physical activity, sleep, stress, and underlying health conditions, not sugar intake alone. Myth 2: you'll definitely feel sick if your blood sugar is high. As we've covered today, the early signs are often subtle, easy to miss, and easy to explain away, which is exactly why so many cases go undiagnosed for so long. Myth 3: thin women don't get high blood sugar. While excess weight is a risk factor, insulin resistance can affect women at any body size, and assuming otherwise can delay diagnosis in women who don't fit the stereotype. And myth 4: this is only a concern after 50. While risk does increase with age, prediabetes and type 2 diabetes are increasingly being diagnosed in younger women as well, which makes awareness valuable at any age. So let's bring this all together. The 8 signs to watch for are increased thirst, frequent urination especially at night, persistent fatigue, blurred vision, slow-healing cuts and recurring infections, tingling or numbness in your hands or feet, unexplained weight changes, and skin changes like dark patches or skin tags. None of these signs alone is a diagnosis, and experiencing one of them doesn't mean something is necessarily wrong. But recognizing a pattern, especially if you're noticing 2, 3, or more of these signs together, is valuable information that's worth bringing to a conversation with your doctor. Your body has been talking to you this whole time. The real question is whether you've been listening or explaining it away. Awareness is not about fear, it's about catching things early when you have the most power to act. If this video helped you understand something new about your own body, let me know in the comments which signs surprised you the most. And if you found this valuable, consider subscribing, because next time we're diving into the connection between PCOS and blood sugar. Something almost no one talks about clearly. Take care of yourself, listen to your body, and we'll see you in the next one.